talked about the cause of delays, and obviously, we've got the government taking an incremental approach. I would imagine that this, discourse, is having a huge impact on slowing the response. Can you speak about the impacts of, say, the delays in the SUAP funding right now, getting out to those organizations and clinics like yours that are, have patients and teams that are required to deliver medicine to people, life-saving medicine?
We are all waiting on the edges of our seat to know if SUAP funding is going to be renewed or extended. And we're scared, and our patients are scared alongside us. My patients are marginalized in a way that suggests that they're not part of the over community, but they are, and they read the news. And my patients are scared. They've been asking me most days for the past 6 months if they're going to lose their scripts, if they're going to have to return to what their lives were previous, if they're going to lose connections with their family, if they'll lose housing, if these programs end and they have to return to the toxic supply. They ask me if they're going to die. And I don't have an answer for them because I don't know if funding is going to be renewed. And the clinicians, for us providing this care, it is an absolute moral distress. We know that when people are deprescribed opioids, as one of our speakers mentioned today, that they turn to the illicit market. And we have decades of data around the opioid crisis since the early 2000s showing that deprescribing predictably leads to death. And so clinicians are in this position where most clinics, most safe supply clinics have maybe a month left of funding, and we don't know if it will continue. And clinicians are stuck. Do they wean people knowing that data shows that many could potentially die if they do so? Do they transition them to more conventional addiction treatments like OAT, such as methadone and buprenorphine, knowing that these patients, have failed multiple times on these previous medications, and the fact that they've failed has led them to be part of a safe supply program in the first place. Clinicians don't know what to do. The moral distress comes from knowing they've been keeping people alive for 3 and 4 years on these programs and not knowing if in a month the people that they care and serve and love are going to die.
Mr. St. Jude, did you want to add to that?
Well, if I understood well the question, c'est aussi la même chose pour nous lorsqu'on a.
Well, the same thing, same situation when we hear critical and negative criticisms. Look, one can be concerned, be cynical or skeptical, and be critical. That's fine, whether it's for supervised site, whether it's safe supply. But this is being done in a context. I'm sorry, but we're at the end of our round of